Hi, my name is Kirsten and I'm going to be your nurse today. The patient appears interested and engaged. Please tell me your full name and date of birth.
Aaron Hubble, 12/17/1999.
Okay, I'm going to check wristband. This is the correct patient. Today I'm going to be performing a focus assessment. It will take 5 to 8 minutes. I'll explain myself as I go through. Please just let me know if you are uncomfortable or have any questions. The patient understands the purpose of the exam. Before we begin, please empty your bladder, put on this gown with a tie to the back, and also are you comfortable with the room in respect to warmth and privacy?
Yes.
Patient is prepared for the exam and he is comfortable with his surroundings. First, I'm going to ask you a couple of questions. So, are you having any difficulty or changes in your ability to move about?
No.
Have you experienced any changes in your muscle strength?
No.
Have you had any difficulty or changes in performing your daily activities?
No.
And have you had any pain in your joints, bones, or muscles?
No.
Okay, patient denies neuromuscular complaints. If you did have any complaints, I will further assess using Old Cards ICE and age-appropriate assessment tools. So next I'm going to ask you to stand up, please. Okay, patient is erect, body is symmetrical and proportional, limbs are straight, symmetrical and proportional, knees are in line with the hips and the ankles, and patient is able to maintain balance. So next I'm just going to be looking at your back. There are no deviations noted in the spine. The cervical, thoracic, and lumbar curvatures are present. And the hips and the shoulders are also in line and horizontal. So next I'm going to ask you to perform a couple of movements for me. So from your hips, if you can lean forward, lean backwards, to the right, to the left, and then if you can turn one way and turn the other way. Did you experience any pain?
No.
Okay, patient was able to perform range of motion with no pain. So now you can sit down. Thank you. The spine and the neck are straight and in line. I'm just going to touch your backbone. Please let me know if you have any pain. Okay, there is no pain within palpation of the spine. So next I'm just going to be examining your arms. So muscle development is generally symmetrical. There is no atrophy and there is no twitches or spasms. So next I'm just going to be palpating your upper extremity, so your arms. Please let me know if you have any pain. Okay, there is no pain or edema. And then around the joints, they are symmetrical and there is no redness, edema, or enlargements of those joints. So next I'm going to ask you to perform a couple of movements just to test your strength. So I'm going to ask you to put your arms out straight, and then if you can bend it 90 degrees. Now try to push against with my resistance and let me know if there's any pain. Okay, now please pull. Okay, tricep strength is 5 out of 5 bilaterally and there is no pain. And same applies for the biceps. The strength is 5 out of 5 and equal bilaterally, and there is no pain. And could you please squeeze my fingers? Okay, patient grip strength is strong. The grip is firm and there is complete flexion of all of the fingers. So next I'm going to move down to your lower extremities. So I'm just observing right now. Muscle development is symmetrical and normal. There is no atrophy and no spasms or twitches. Next, I'm going to just palpate your legs. Please let me know if you experience any pain. Okay, there is no pain or edema of the legs. The feet are in line with the legs and the toes are straight forward. Now I'm going to just test your strength of your legs. So I'm going to ask you to push against my arms and then pull against my arms. Okay, please push forward and pull back. Okay, strength of push and pull is 5 out of 5 and it is equal bilaterally against full resistance. Okay, thank you.